Welcome everyone to this webinar, which has been hosted by the Royal Australasian College of Surgeons. The aim of this webinar is to update you on aspects of surgical training, supervision, IMG pathway to fellowship, particularly in response to the COVID-19 disruptions. On behalf of the College of Surgeons, I would like to pay my respects to the traditional owners and custodians of the lands on which we're meeting today, and to also pay my respects to their elders past, present and emerging. Tēnā koutou, tēnā koutou, tēnā koutou katoa to our New Zealand members on tonight. My name's Adrian Anthony. I'm a general surgeon based in Adelaide. And I'm also the chair of the Board of Surgical Education and Training. So for those who don't know, the Board of Surgical Education and Training is where all the training boards convene, and obviously we govern the training program through that structure. I'm also a counsellor. Now with me tonight, we have on panel, we have Associate Professor Julie Mundy. Julie is a cardiothoracic surgeon based in Brisbane, Queensland. Julie is our current Vice President, and she's also a member of College Council. So welcome, Julie. Professor Chris Pike, also from Queensland, a general and breast surgeon, and Chris is the chair of the Court of Examiners, so something that is going to be very important for many of you listening in tonight. And of course, Chris is a council member as well. So welcome, Chris. Next, we have Associate Professor Karen Fielding. Karen is an orthopaedic surgeon based in Wagga Wagga in New South Wales, sorry. And I'll just turn off my phone. And Karen is also the chair of the IMG committee and also the deputy chair of BSET. Now, James Churchill, welcome, James. James is the chair of the RACSTAR, which is the Training Association, and also a final year SET trainee in urology based in St. George in Sydney. So welcome, James, and your perspective is going to be really important tonight as well. So thank you all for agreeing to take part in this webinar tonight. In the background, you cannot see, is Grace Chan from the college, and also Julian Archer, and they will be helping out and coordinating any live questions that come through. Now, thank you very much for submitting your questions beforehand. And as a result of that, we've been able to identify some key themes which you would like us to address tonight, and which we will address. The first is fairly obvious, and that relates to the fellowship exam. So what is happening in that space? So you will be updated on that. There are also some questions on other exams, the specialty specific exams and the general surgical science exam. So we will address some questions there. And the third theme tonight is around what is happening with training, and particularly around progression in training and assessment of training in this disrupted time. So we will address those concerns. If attendees do have other questions they would like us to answer during the webinar, please type them into your question pane, and we will certainly try our best to answer those questions. This webinar is being recorded, and it will be posted on the college websites, and we'll give you the link for that after the webinar. Before we start on the questions, I would like to say that the college is very mindful of the disruption that COVID has caused, and also of what's been happening in various parts of Australia and in New Zealand with the recurrence of COVID numbers and the infection. And we understand that whilst this has a variable impact on various people, both professionally and personally, it is a source of a lot of anxiety for many of you. And so we do acknowledge that you are going through that difficult experience. The other thing that the college is certainly well aware of, and that is that COVID is not going to disappear suddenly. It will be going into the future. It will be going into 2021. And so we're working very hard to develop ways and processes where we can continue to support your learning so that you can continue to be trained whilst maintaining safety around the COVID environment. All right, so what we should do is really start off on answering some of the questions around the fellowship exam. So the first question I thought I'd pose to Julie and also to Chris Pike. What are the plans for the fellowship exam in September and in October this year? Julie.
Okay. Well, look, providing my internet connection stays up, I'll answer that. So we met the other night, and you know, obviously over the last month things have changed quite considerably. We did make a determination back at the beginning of May when we set the dates that we would try and hold it in one venue and make it as similar to the normal exam as possible. And as time's gone on, especially over the last month with the resurgence of COVID in Melbourne, and also more recently with the resurgence of COVID in Auckland, it's quite evident that that is not going to be possible. And in fact, it's not going to be possible to hold the clinical vivas in a single site. So what I'll do is I'll deal with the writtens and then I'll deal with the vivas. So the writtens are still intended to be held on the 8th of September. And as previously, they will be held in multi-sites. We do have permission for the writtens to be held at Clifton's in Melbourne. They have an appropriate COVID safe plan and they have the facilities for physical distancing. We also have approval from the Chief Medical Officer in Victoria for the candidates to attend that site in Clifton's to do those exams. All of the other state capitals are fine. The problems that we do have, though, is with some of the regional candidates, and we are in the process of trying to set up some regional hubs so that the writtens can be done in those hubs, and we're looking at places like Geelong, Bendigo. We will probably try and run an exam in Canberra. We're not sure about Tasmania, but we will be in touch with the Tasmanian candidates to see whether that would work for them down there. We're also looking at regional New South Wales because we are aware that their health services have put a block on them going into the Sydney metropolitan area, which is something that we only found out Monday night. So we are reasonably confident that all trainees will be able to have access to the written exam in a venue that is reasonably close to where they are working. And providing they are not unwell or in isolation, they will be able to do that exam. The vivas pose a much bigger challenge because they require not just the exam candidates to be present, but they also require the examiners to be able to travel. And just as there are limitations on the exam candidates getting to various venues, there are limitations on the examiners likewise. And we don't have a proportionate number of examiners in every site to trainees in every site in every specialty. So this is quite a significant logistic exercise. So where we would normally be running 9 sites in Australia in one single city, at the moment it looks like we could be running about 26 sites over about 5 different cities. Now, this is still in the working out stages, but we anticipate that Melbourne trainees will be examined in Melbourne, or Victorian trainees, sorry, will be examined in Melbourne. New South Wales trainees will be examined in Sydney. Brisbane trainees will be Queensland trainees will be examined in Brisbane. It is likely that Western Australian trainees in some specialties will perhaps be done in Western Australia, but they also may travel to South Australia. South Australian exam candidates will probably remain in South Australia, though some in some specialties may go to Queensland, and Tasmanian candidates will probably go to South Australia. Now, I'm aware that there are border restrictions, and we are working hard to contact the various health departments to see if we can get exemptions so that there is no quarantine involved. It would appear that Tasmania, Western Australia and Queensland can all get to South Australia. It's a matter of what happens when they go home. But if we can get the exempt status so that they don't have to quarantine, that would obviously be the preferred situation. As far as New Zealand goes, the writtens, depending on what restrictions they have, will either be in Auckland and Wellington. The clinical vivas will be in Auckland, though if Auckland is still under restrictions, we will have to look at alternatives there. So as you can see, those clinical exams are still 5 to 6 weeks away. And if the last 3 to 4 weeks have taught us nothing, it's that we really can't plan too far ahead because we don't know what's around the corner. But I'm reasonably confident that barring something absolutely catastrophic closer to the exam, we will be able to provide the opportunity for the clinical exam for the vast majority of candidates. And we are hoping that we can provide the written component for all candidates. Now, if we get a situation where you have completed the written exam, but your component of the viva goes down for some reason, so it might be the general surgical component from Brisbane, or it could be whatever, we would then hold over your written result, and we would look to perhaps try and run another sitting of clinical vivas, possibly later in the year. And that once again would depend on whether the situation that caused it to be cancelled has been resolved or not. So, look, I'd love to give you absolute specifics at this stage, but that's about as close as the specifics as I can give. One of the problems that we are having is that to some extent, we don't quite know where some of you are. We're using the hospital you're working in as a surrogate, but it's possible that some of you have arranged leave and planning to be in a different place for your exam. So you may get communication from the college over the next week. So please be patient. Don't just sort of say, why do they keep contacting me? It's just that we are trying to make sure that we've got the right number of candidates in the right locations and that we have a matched number of examiners. Now, there will be some changes to the exam. There is no change in your curriculum content, and there is no change in delivery in that they will still be viva voce exams. However, because these are now going to be state-based exams, they will be state-based examiners. So you will have more examiners examining you from the state that you are sitting the exam than you would have previously if it was a nationwide or binational exam. You will also possibly be examined by the same pair of candidates on more than one occasion, which for the small specialties is nothing new, but for some of the larger specialties, that's a new concept. Where there is going to be sort of multiple vivas being performed by the same pair of examiners, there will probably be an independent observer, and that observer may be on Zoom or video, whatever video conferencing is available. So it will be a little different, and I understand your anxieties, but you are also mature adults, and if you believe that that uncertainty and that those changes of not having the same breadth of examiners is not acceptable to you, then you need to consider withdrawing, and we will refund your money fully. But that is going to be the best that we will be able to achieve this year. And unlike some of the other colleges, such as radiology and even anaesthesia to a certain extent, we don't want to just take the easy path and say, oh, it's all too difficult, let's not have exams. We are very keen to try and get the whole 293 of you to sit this exam by the end of the year so that you can complete that component of your training and allow you to progress through your career. But you do need to be aware that there will need to be some compromises made, and we are doing our best to come up with a good exam for you. But if you find that's not going to be acceptable, then we do not have a problem with you withdrawing before the writtens, so that and we will refund your money. So I'm not sure if you want anything to add anything else, Chris, but I've tried to sort of encompass the.
was very comprehensive, Julie. If I can just reinforce that our aim is to provide a safe and valid exam, and our overall emphasis has been on minimal change if we could. There have been some changes in some components, and the senior examiners in your specialty will have communicated in writing last week. If I could refer you to the notes to candidates that were sent out from the college, that would be the source of truth. So at the moment, vascular surgery, plastic surgery and neurosurgery will continue to have patients for some of their vivas, and the other specialties will not. So urology hasn't had patients for many years, but general surgery, otolaryngology, head and neck surgery, orthopedic surgery and pediatric surgery will not be having patients for this exam, and there are some altered components in what would have otherwise been the clinical exams, and your senior examiners and specialty courts will be able to give you some information about the new format of those vivas. We have endeavoured to not depend on technology unless we have to. If technology is used, it would be mainly for observing, if possible. There will be some specialties where the number of examiners in a particular location, as Julie just said, is so few that we may have to use technology as one of the examiners, a Zoom examiner or a Google video link examiner. But as I said, a safe exam for both the candidates and examiners, and a valid exam based on the blueprinting which has already been done with the minimal change to the components.
Well, thank you, Julie, and also thank you, Chris. Yes, I agree that's a fairly comprehensive summary. There's a lot of information in what you've said. Can I just unpick some of that? You mentioned about the writtens being in Clifton, and I guess that's one component that will rely on technology, in that the writtens are done on computers. Now, Cliftons, for those who don't know, provide a very standardized, predictable and secure location for undertaking the writtens on computers. But for those who are not able to get to a Clifton centre, i.e. those in regional Australia and in some of the states that you mentioned, Tasmania as one, what location are you envisaging these hubs to form outside of the metropolitan areas?
Yeah, so look, at the moment, we're still pursuing those. Some of them may still be, so ACT may well be at the college premises. The site in Geelong, one of the orthopaedic senior examiners organising that. He has a venue where he thinks that, in fact, he may be able to still do a computer-based exam. Where we can't access appropriate secure computers, it will be a written exam. It will be paper-based. But we are hopeful that we can get as many sites hooked up to Moodle and do the same computer-based exam that we would normally do. But every venue, so even all of the capital cities that are being done in Cliftons, there will still be backup paper-based exams in case the technology goes down, which is always the case. So
it's not always the case technology goes down, but it's always the case you have a backup plan. Yep.
Well, we have backup written papers at the site for every candidate. Yep.
Understood. Yeah. Okay. Yes, Chris.
Adrian, I think one of the pre-populated questions asked about the American college exams, which had failed home proctoring.
Yes.
We're not depending on. The only proctoring that we'll be depending on is face-to-face proctoring. There'll be people in the room at exam centres. We're not depending on remote locations with remote proctoring.
Yeah, okay. And a question's popped up on the webinar, which is also relates to an issue I was going to just seek some clarification. The question is, our state has one examiner in our specialty. What happens in this event?
Yeah, not knowing the state and the specialty, I can't tell you exactly, but certainly I know that in my own specialty there is that situation. There will always be at least one examiner in the room. There may be a second person in the room who is an observer, and there may be a zoomed in examiner, and I'm using zoom as a verb here, not a noun, a zoomed in examiner, or there may be two examiners in the room and a zoomed in observer to just ensure that there's not any significant bias. I think James got a comment.
Yep, and James,
yeah.
and then Chris.
Adrian, I just thought I'd also add, I mean, there has been quite a lot of effort by the college to recruit as many examiners for this round of exams as well, and many previous examiners have been essentially reoriented to what the exam's about these days and brought back in, so that we've got the largest number of examiners to support the decentralised exams that we're planning forward for. So while these situations are arising where we've got small numbers of examiners and exam candidates, really we've tried as hard as we can to have that situation as rare as it can be. But obviously small specialties are small.
Yeah, and it is a good point to make that the recruiting the examiners who are recent past examiners involves retraining them, so they go through a retraining process. Yeah.
So there are actually 46 past examiners who are undergoing a reskilling process, as well as 32 new examiners who are being refreshed. I see Robert, it's Western Australian Plastics. My spreadsheet, Western Australia examining in Adelaide. So I think you'll find that, as I said before, some of the Western Australian candidates, the plan is to have them go to Adelaide.
Yeah, and that really addresses one of the other issues that has cropped up in the questions, the pre-webinar questions, and that is, why can't we hold all specialties, or why can't all specialties hold exams in all regions? And I think, Julie, you said that wouldn't be possible. You need a critical number of examiners to match up with, well, you need critical numbers of examiners, and it may not be possible. In fact, it isn't possible to do that right across all the regions. Chris, can I ask you a question that's cropped up on the webinar? In specialties with live patients, is it likely to remain the same regardless of the current conditions? Now, I think that means, is it going to be possible to have live patients in those areas? For example, in New South Wales at present, visitors to hospitals are restricted. Presumably this would extend to patients in the exam.
So there are a number of mitigating strategies for that. Good question, by the way. Look, we are seeking permissions from the various health departments from the jurisdictions about the use of patients for exam purposes. The other thing is that we will only be conducting safe examinations, so there'll be a screening for COVID for both examiners, candidates, and patients if necessary on the day. So it would be a safe exam, even if you're, even if it meant that everyone was in full PPE to do it. I would see that as a kind of Armageddon solution, though, really. The other contingencies we have is that if a safe exam can't be performed on the day that we said, then we are already scheduling, or at least tentatively scheduling, more Viva examinations between now and the next scheduled exam in May next year.
Yeah, okay. A few more questions around the writtens. If the written exam is held and then the Vivas cannot be held, so a candidate then comes back and does a Viva later on, are they informed of the outcome of the writtens in that interval time, or will they have that written result held back until they complete the exams?
Yeah, the written's not a separate exam. The written is just two of 7 components of a combined exam. So the way that there is already a month between the writtens and the Vivas, there may be 2 months or 3 months, but no, there is no pass-fail on the writtens before going on to the Vivas. That's not how the fellowship exam works. Yeah.
A couple of questions to you, Chris. One is about in regional New South Wales, is one of the hubs going to be Dubbo? And also, what are the locations likely to be? Are they going to be hospitals, people's private rooms, college facilities? Are you able to answer that?
The advice, to answer the first one, I think Wagga runs on the board with a number of counsellors and a number of examiners which come from Wagga. I think there are two, one current and one former examiner in general surgery and quite a number in orthopaedics. With respect to, sorry, the second part of the question, Adrian.
So if it's going to be held in Wagga, then whereabouts in Wagga? Is it going to be a hospital?
Sure. So we've received advice from the Commonwealth already that they don't like doctors congregating if we can avoid it. Having said that, we have dispensation to run the exams, so either private rooms in outpatient settings or private rooms in specialist clinics, either private, in private practice or at the hospitals. Either venue would be okay, but our intention is to use public hospital outpatient settings as usual.
Yep. Karen, did you have something to say there?
I was just going to say, we've also got in regional areas, we've got university clinical schools that we're already starting to run courses in, so that would be another option.
Yep. Okay.
So we only discovered the problems with the regional New South Wales on Monday night, and so we're currently finding out where everyone is in regional New South Wales, and then once we get those numbers, we'll sort out little hubs and sort out venues and appropriate invigilators, which may well be surgeons.
Right, yeah. Okay, so I should make it very clear, we haven't formalised any of the regional hubs yet, so don't take it that Wagga is definitely one of the hubs, but I think the ideas that we've been articulating are hopefully give you an idea, particularly for candidates who are not in metropolitan areas.
I hope to have that in the week, Adrian. I hope to have that by the end of the week, and I'll also be writing to the exam candidates at the end of the week with an update.
Okay. Right. Well, that's a good segue to one of the key questions around communicating all of this information to the candidates. So what's the process of getting this information in a timely, consistent way, and information which is not going to create confusion or anxiety? So what strategies has the college adopted for this? I might ask Chris to start off and then Julie. Yeah.
So the examinations, the Court of Examiners and Examination Department have formed a joint working party which meets fortnightly to consider current government advice in both countries and travel restrictions. And although we were planning on everyone flying to one centre, it's clearly now a situation where we're looking at whether some hard borders are going to exist. There have been 5 bulletins which have come from that working party thus far, as well as a number of letters to candidates, and I expect that we would endeavour to communicate after these meetings increasingly frequently leading up to the October exam. But we do meet fortnightly to consider all those things, and we try not to put something into print until we're relatively sure of how that's going to play out.
Yeah. Julie, anything to add to that?
Yeah, so look, I sent a letter to all of the exam candidates about 10 days ago, and after our last meeting, and I'll be sending another one by the end of this week, and we'll continue to do that. We also will communicate via email if we need to get something out more urgently. There was also a question that came through about what are the qualifications of an observer in a Viva setting, i.e. a consultant in our specialty without formal examiner training. All of the observers are actually either current or former examiners, and I think at the moment they are all in the same specialty, but I can't guarantee that into the future. But they are all either current or past examiners.
Thank you, Julie. James, I just wanted to get your perspective about the communication. I mean, you are obviously bring that unique perspective because you're closer to the action, so to speak. So what words or what reassurances can you give your colleagues who are exam trying to prepare for the exam and trying to grapple with all of these complexities and trying to make some sense of all of this?
Yeah, thanks very much, Adrian. I mean, obviously, that's the main question that comes to trainee representatives. What more communication can we gather about the contingency plans that exist around the exams? I think that Julie and Chris's updates that have been provided tonight are very useful for that, but also illustrates the degree to which the plans that are being developed are just so highly changeable depending on what restrictions we have in place at various times and as those develop over time. What we've attempted to do is to communicate as often as we can about things that we know, and to avoid communicating about things that we don't know, but to give the broad brushstrokes of the types of plans that we can commit to. We absolutely, and I trust and have seen that the Exams Working Party is cognizant of the need to communicate with trainees about these contingencies. And as we get closer to the exam, each of those dates that sit, both for the written and for the clinical exams, the plans that we will have to set in place to be able to deliver an exam for as many candidates as is possible as an absolute aim is able to be then communicated closer. We'd love to be able to say this is exactly what's going to happen in 8 weeks, but I suspect that if we do, that we'll make perhaps a mistake that other bodies have made, which is communicating something and then finding that all of a sudden you can't deliver what you promised to deliver. We very much want to be always heading in the direction that we think we're heading, and to change that tack as infrequently as we can. It's certainly, we hear the trainees' concerns loudly and clearly, and certainly as the trainee rep in these meetings, I'm very, I think Julie would certainly attest to the fact that communication to trainees is always a very firmly front and centre thought.
Yeah. So if a candidate has a question they want to have clarified, let's say we put the college puts out a communique, who would they approach? Should they approach the specialty training board, or should they approach the examinations department? Who can they approach?
I might refer that to Chris, I suppose, specifically in terms of process.
Yeah, look, I think in the first instance, if it's about the conduct of the exam, it should go to the examinations department. So Mark Prestipino is the executive officer. I hope I've got your title right there, Mark. And he reports to Philippa Davis and then through to Julian Archer, who then reports to the Examinations Working Party. So all of those, there's a mechanism to escalate those queries. That they would often communicate those questions directly to the senior examiner in your specialty. There are two broad areas. There's the logistics of the exams, and then there's the content and the delivery of the exam, and it would be appropriately delivered to the right person.
Thank you, Chris. And while I've got you online still, I know the registration for the September-October sitting has closed now. What can you tell us about the capacity to accommodate for as many applicants, or sorry, candidates as possible, so that we're optimising this exam attempt?
So unless there is a health reason to not proceed in a location which you would otherwise be able to attend, then it would be our aim to examine all the people who've registered for this exam. So the only thing I think that would stop us there is the inability of a candidate to travel to an exam centre, or the inability to get examiners in that centre, and that would be purely based on governmental restrictions. We have contingencies in almost all jurisdictions, which we're working on to get around that. I mean, however, there are some, almost all specialties could accommodate for all the people who wanted to do the exam this year. I know general surgery couldn't accommodate all of people who were otherwise eligible to register. I have to say, general surgery are about to sit the biggest exam they have ever done across 2 countries in the most centres that they've ever sat simultaneously. So I I think to get 89 candidates, which I think is their numbers presently, is quite a good effort all by itself. However, we're aware that we will have a cohort of people who are eligible to sit the exam, and the next subsequent exams in the next little while will have to be large as well to accommodate for those who didn't get to sit this year. But to answer your question, sorry, Adrian, waffling on now, but unless there's some reason either the candidates or the examiners can't get to an exam centre, we would endeavour to examine all of the people who've registered this year.
Yeah, but it sounds like from what you said, the numbers have not been restricted to less than what they usually are. In fact, if anything, in some courts, they're examining record numbers. Is that correct?
At a single exam sitting, yeah. I mean, ordinarily we have 2 exams per year in in many specialties.
Yeah. Okay. So, in looking ahead, if there are further disruptions to the exam being conducted this year, I'm not sure whether you're in a position to indicate whether for the next year there will be greater capacity to accommodate as many candidates as possible, because I guess some of the anxiety is about not being able to sit this year and then having to compete for exam positions next year, particularly if there's a cohort of candidates coming through this year who still need to be accommodated next year. Are you able to comment about the capacity in next year's sittings to accommodate as many candidates as possible to try to get through that backlog, so to speak?
Well, some of what I say will be speculation, and I hope it's received in that light, but we are all colleagues. Like the candidates who are lining up to do our exams are future colleagues, and we would hope that there will be shared learnings from this next sitting of the exam, which may liberate us in the exams. The delivery of the exam may liberate our thinking a little in exam delivery or content, or there will be learnings from this exam coming up which will help us mould what happens next year, Adrian. That's probably the best way to summarise it. Otherwise, I think our intent would be to have as many people as has been this year, to have as many people through in the time that they're eligible to be through as possible. So our aim would be to examine as many as possible, even if it means yet another biggest exam ever.
Yeah, okay. Karen Fielding, I might ask you a few questions, and then there are some other questions that have cropped up on the webinar, and we'll address those as well. But Karen, can I ask you, clearly the SIMGs, the Specialist International Medical Graduates on Pathway to Fellowship, are in a slightly different position in that they have contracted positions in which they're working. They have to pass the exam in a given time, and in some situations, SIMGs may actually be out of contract. That is, they've completed their oversight, but they're still exam pending. So what support will the college give in terms of allowing them to have ongoing registration with AHPRA? I guess that's one question. And also the second part of that question is, what sort of support will the college give them in terms of securing a position of work so that they continue to be gainfully employed?
As far as the registration goes, if they have a problem with their registration finishing and they need an extension, then they just need to get in touch with the SIMG office at the college, and we will help them with that. That's not a problem. So that's the first part of the question. The second part of the question, I mean, we can't find them a job, but we would definitely give them extensions so that they can complete mandatory courses or exams that they haven't completed, even if they have finished their clinical time. And we would certainly try and, you know, perhaps give them some advice about jobs that would be suitable. And we would advise them to have a look at some of the fellowships around that will not be able to be filled by international trainees or fellows. So please get in touch with us at the SIMG office, and we'll give you as much assistance as we can.
Thanks, Karen. So it seems like AHPRA registration is not going to be an issue, and I don't think it's ever been an issue. As long as you're on a pathway to fellowship, then the college will support that. I think the yeah, securing a job certainly is a lot trickier, and you're right that the college has no formal processes for identifying jobs for or positions for SIMGs, but certainly the training boards would also be another source of support, because training boards may be aware of vacant positions that may be suitable for SIMGs to occupy. So I guess the message is, don't feel that you're alone, that you should contact the IMG department, and the IMG department will also liaise with the training boards.
Right, yes.
Okay. And for trainees and IMGs who have completed all of their requirements except for the fellowship exam, what will actually happen to them? Will they require extended training, or will they, well, someone has asked whether they would be exempt from the fellowship exam before they got the fellowship. I guess that part is easy to answer. No is the answer. There is a standard, and an AMC requires that we qualify surgeons to that standard. But in terms of trainees and IMGs who are exam pending, what happens to them?
So if they've completed their time and they have finished their position or their accredited training time, then certainly they should get in touch with their specialty training board, because there may be some spots available that they could be supported to work in until they do the exam next year, if they're doing it next year or later this year. And they should also, if there are SIMGs, as we said, get in touch with the IMG office. And then they could also have a look around at some of those unaccredited positions while they're waiting to sit their exam.
Yep, thank you. Look, a few more questions that hopefully we'll cover off fairly quickly on. Will there be COVID testing requirements prior to attending the exam? And that one's to Julie Mundy.
Yeah, so look, that we will be bound by whatever the regulations are in the particular state. It's possible that there may be temperature checks. If you're having to move interstate, there may be a mandatory requirement that you have a COVID test, 3 days or something before you move to that other state. So whatever requirements exist, the same thing goes for border passes. If you have to go from Tasmania to South Australia and back to Tasmania, in and out of Western Australia, you may have to apply for I think it's a G2G pass. So we will be bound by the rules of whichever state you will be sitting the exam in. So if you're in Queensland at this point in time, you would not have a requirement to have a COVID test.
Will candidates be advised of that ahead of time, or is that something we expect candidates to identify themselves?
No, it'll be made clear to those candidates that have specific requirements, but the fact that they will already be working in that state, I would imagine that they will probably already know that.
Yeah, okay. Will Chris Pike, will candidates get examiners that they have worked with?
Yes, it's much more likely. I'm just trying to type a response to that question in my two-finger technique. The question there is about whether there's a conflict of interest, or how do we mitigate for bias. And previously, it's been done by having examiners who are fairly anonymous to the candidate. In a limited pool of examiners, where we have a well-developed rotational system where it's unlikely you would get exactly the same two examiners for every single part of the exam. So we've tried to mix things up that way. The other way is to have observers to watch for any, or at least the exam technique used by the examiners, and to have that as a safeguard, even if the observer had to be present only by technology. So we'll have increased number of observers and a complex rotation, so that there's frequent mixing up of the exam pairs, even if you know some of them.
Right, okay. And someone's asked a question about, in the clinical exam, how we're managing bias and unfairness, and I think you've answered that. One other question which I can answer is if a candidate, well, if a trainee or an IMG has failed an assessment, will they be permitted to sit the exam? At the end of the day, that's actually determined by the training board. the training board will determine whether a person is actually ready to sit the exam, and they will then sign that person off. I think we should move on to training and assessment. There were a couple of questions about other exams. I can confirm that the GSSE, the General Surgical Science exam, is being conducted this year in November, and that's obviously for the preset group, so for our most junior of colleagues. And will the specialty specific exams be proceeding in 2020? The answer is yes, and that's been organised through by liaising with each of the relevant specialties. So if you have any questions, please liaise.
So Adrian, I
Yes?
think the only special one that's not going to be held is cardiothoracic.
Right, okay, thank you for that. So let's move on to training and assessment, which is one of our key themes for tonight. And Karen Fielding, I was wondering whether you could tell us what are the training boards actually doing in terms of managing the training requirements, given that much of or aspects of training opportunities have been disrupted by COVID?
Yeah, so I mean, everyone's experienced a slight reduction in their caseload, but the training boards have all had a look at that, and I know that Adrian has recently talked to all of them about the numbers, and they don't think that's going to significantly affect any training. And I think you're all aware that we've been recommending to all the training boards and to all trainees that you work on your non-technical competencies during this time, and that certainly is, there's lots of stuff there that you can tick off in your training to be working on. So really that's where we've been working, and we don't think that this period will negatively affect any training.
Yeah, yes, and I've been reassured by every training board as of yesterday that they are trying to progress trainees through, and whilst there's concern about logbook numbers, the vast majority of trainees actually are progressing even with reduced logbook numbers. And those who are found to be deficient, I've been advised that the issue is not so much the deficiency of training opportunity, but issues around performance. So there is, I guess, a challenging aspect to training boards differentiating what is truly underperformance and what is performance affected by the lack of training opportunities. And I think training boards are acutely aware of making that distinction. And certainly as of yesterday, the information I was receiving is that they are making sure that trainees are actually progressing. And also, as Karen said, the assessment is across all competencies, not just the one or two that relate to operative exposure. Yeah. So, Karen, who should trainees approach if they feel that their assessment is an unfair one, because as an in-training assessment is unfair because they've actually had reduced training opportunities? How should they manage that?
Well, if they feel comfortable, they should speak to their supervisor in their hospital. And if there's been, you know, if they feel uncomfortable about talking to their local supervisor, then they should get in touch with their specialty training board. Many people there that they can talk to offline. And but yeah, that's really what they should do.
Yeah. And James, have you got anything else to add?
Yeah, each specialty and each training board approaches the process of escalation of questions about training assessments in a slightly different way, and they will no doubt have come across situations where there were you know, questions about how an assessment is performed and completed, and there will be people who you can then go to talk about how that was done. I certainly support Anthony's comments that the specialty training boards are out to bring trainees through the current situation that we find ourselves in. Certainly there's a strong view that trainees should not be penalised for the fact that we happen to be training during the time of COVID, and trainees won't be held back because their logbook numbers are under what they should be. And indeed, as Adrian's investigations this week have concluded, so far at least no one is finding themselves in that situation. If you think that you are, then certainly talk about it with your supervisor, talk about it with your training board and your chair of your training board about what that might mean.
Yeah. So I would certainly encourage people to have that discussion and have that dialogue with their supervisor and with the training boards. I don't think it's something that you should let fester or go unanswered. It's an important question and it's an important issue. Someone's asked about what about skills assessment? I'm not quite sure what that's referring to, but certainly, let's say if we're talking about psychomotor skills and technical skills, I don't think all operating has stopped. A lot of operating has stopped, but not all of operating has stopped. But even if operations have been deferred and a trainee or an IMG is unable to demonstrate those skills, the college is not, and in fact all training boards are not focusing on one competency. They are looking at all competencies. And so your collaboration, the way that you manage, the way you lead in that situation. And in fact, COVID has probably required us to draw on those competencies a lot more than we normally would. And so those competencies can be observed. Those, the behaviors around those competencies can be observed and are being assessed. So if a trainee or an IMG is unable to have their operative skills assessed for a period of time, the training boards are not going to say that breaks the issue. It's a make or break situation. Clearly, there is flexibility and understanding and accommodation, because we all recognise that there will come a time where those competencies will be able to be assessed. So I don't think that that's going to be an issue. So Karen, what happens if a trainee is unable to access a mandatory course? Many training programs have courses, CRISP, EMST.
Yeah, so unfortunately they're mandatory, but we do understand that, that they've been delayed. We're starting the courses in 2 weeks. We're running the first EMST course, and a lot of the other courses are starting to run in the next month. So if you need to get a course done in a certain period of time, you certainly need to get in touch with the skills department at the college, and you will be given some preference up the list. And I've certainly had a couple of IMGs who've been in that situation where we've found courses. Some of the courses have gone to an online, have online modules, so there's quite a bit of scope there to complete. So if you have any questions or you're concerned, please get in touch with the skills department at the college or your supervisors, and we'll help you with that. But yes, there are mandatory courses that need to be done.
Yeah. It's also caused the college to carefully look at these courses and to determine why these courses need to be delivered face-to-face, and whether there are aspects or whole parts of the course that can be delivered online. And if they can, then those modules will be developed. So it's certainly been a testing time, but also a time for actually developing new educational materials. So my understanding also from training boards is that if someone is unable to access a course, then that won't be sufficient to hold them back. They will continue to progress, and once those courses become available, then the expectation is that they'll meet that. Okay. And I guess the question then that has been asked is, will trainees be given exemptions from not sitting the course, or will they be required to extend their training? And it may not be related to a course. It may be that they haven't been able to demonstrate across all competencies. Will they be either given an exemption from demonstrating that learning, or will they be asked to extend their training? Karen, do you have a response?
You have to access a course, and like I said, we will try and put you up the list. So it depends on whether or not they have finished their other training, if they've time completed, and certainly we've got several IMGs who are time completed who just have to access a couple of courses, and they will get their fellowship as soon as the course is completed.
Yeah, okay. And I think for training programs which rely heavily on the competency-based assessment, they may actually be looking at how they may assess the performance competencies of trainees other than by some of the more traditional methods. So there may be other ways of assessing the competencies, even though there's been reduced training opportunities. A question that has come through, and I guess it's a little bit unusual, but the question is, given the disruption to training in accredited posts, should trainees or SIMGs be seeking out other posts as in non-accredited positions that they feel may actually provide better training? So I thought I'd ask Karen that question and then ask James for an opinion on that question as well. Karen?
Our advice would be, if you're in an accredited position, it would be a very bad idea to move to an unaccredited position, because you may actually lose your position in an accredited post and on the program. So you would be ill-advised to do that. It would be best to stay in your accredited position, talk to your supervisor about what problems you have accessing your training. For IMGs, it could be slightly different. So if your time complete for an IMG or for a set training as well, if your time completed, then it may be appropriate to take an unaccredited position to fill in time while you're doing an exam, but not as an alternative to doing your accredited position.
Yeah. James, your views?
Yeah, I mean, training boards are certainly very cognizant that posts are impacted by COVID, and the activity that we're undertaking is different and in many places reduced. There should be very, very rare circumstance by which there'd be activity going on, training activity going on in an unaccredited post, anywhere near a training activity that's reduced in an accredited post. And so I think that would then reflect that the post just needs to be aware that something has changed that they might not be aware of. So if you think that you see a post around that's got better activity as an unaccredited post than an accredited post, and this question's been raised in your mind, talk to someone about it, because that's really unusual, and I certainly wouldn't recommend anyone be exploring things outside of their training program in preference to the spot that you've got.
Right, okay, thank you for that. All right, and it also touches on another question that we've had, and that is, if these training opportunities have been substantially reduced in some of these posts, will these posts actually be losing accreditation, or should they lose accreditation? Karen?
So no, at this point in time, the college is absolutely, the principles that we've been working on is that accreditation will not be affected by the COVID crisis, and the accreditation will be looked at again next year. So no post will be unaccredited this year because of COVID.
Yep, and in principle, training boards do not withdraw accreditation from any training posts without providing opportunity for training posts to address the issues. And these are not things that happen overnight. A problem has to exist in a training post for a period of time, and obviously the nature of the problem is also taken into account. But per se, COVID is not, it would not be seen that it would be appropriate to withdraw accreditation. We've pretty much come to the end of our time, and I would like to thank all of you for answering the questions and providing this information. We still have a couple more which we may be able to quickly address. One is IMGs are concerned that they're going to be penalised because trainees will take priority over sitting the exam compared to SIMGs. Karen and Chris?
Yeah, no, that's not correct. Certainly, if you've applied to sit the exam, then you'll be given the same opportunity as a set trainee.
Thank you. Chris?
All registrants are equal in the court's eyes, and all specialties except general have accommodated all registrants this year.
Yeah, okay. I don't think there's any quota or even an idea of a quota between SIMGs and trainees. Julie, if the plan is Adelaide for WA Plastics, can I assume that the same goes for WA ENT?
I did type a response, but I don't know if it got there. No, at the moment, ENT have expressed that they anticipate they will be examining in Perth.
Right, okay. And will Canberra-based trainees access the Viva exam within New South Wales?
That's
Probably.
still,
Yep.
it's still being worked out.
Right.
That's part
Okay.
of the approval that we're seeking. We regard the ACT as the same as the regional New South Wales. So we're seeking approval for them to do the Vivas in Sydney.
Yeah. And this will be the last question because we've run out of time, but it's quite an important one. Compared to our predecessors, we have definitely received less training and operating opportunities due to COVID. However, we are still expected to complete our training in the same 4 years. So I guess the concern is that they may not be ready or competent. So whilst that is a commonly perceived situation, the reality is that training boards are saying, no, we are being flexible. There will be many trainees who will have demonstrated and will feel that they have demonstrated competency within a certain time, irrespective of COVID. And of course, there will be others who will not feel like that. For those trainees who don't feel like they have demonstrated competencies, or if the training board believes they haven't done that, then they will be offered an extension to training. So the 4 years is not a rigid fixed time. It doesn't mean that after 4 years you sit the exam, you pass that, you're out. And in my experience, even before COVID, some trainees have actually requested an extension to training because they've been fairly insightful about understanding how much more time they will need and how much more opportunity they'll need to actually achieve their competencies. So that's why we do have extensions to training, and that was one of the key principles that we developed in making decisions about IMGs and trainees within the COVID era, that if someone requires an extension to training, then they will be provided with that extension. And so we do not want trainees and IMGs graduating feeling ill-confident or even incompetent to actually perform their job. That is not the standard that we are training to. I think on that note, we should end this webinar. It's been a very informative webinar, I hope, for you. I've certainly learnt quite a bit. And as the situation evolves over the next few months, we will continue to hold webinars as required. Thank you very much for your time, all of you who've attended. Thank you to the panelists. Please note again that this has been recorded and it will be on the website. I should put in a very quick plug for next Wednesday. There's another webinar hosted by the college for the preset groups. So if any of you listening out there have colleagues who are in the pre-vocational preset cohort, please let them know about that. And there is also a educator session on Thursday the 27th with Mr. Neil Price, who is a paediatric surgeon based in Auckland, and he will be talking about a surgeon reflecting on insight. So for those of you who are interested, please log in on that. Thank you very much, everyone. Stay safe, stay well informed, and we're here, remember, as a college to support each other. So look after each other, and please have a good evening.
Thank you very much.
Thanks, Adrian.
Bye.
Bye.